Congresswoman yields back. The chair recognizes Dr. Miller-Meeks for 5 minutes.
Thank you, Mr. Chair. We're here today talking about reauthorizing the Support Act amid an opioid crisis that is now worse than ever. According to the latest CDC data, we have lost more than 110,000 Americans due to drug overdose deaths in 2022. It's estimated that 75% of these deaths involved opioids, and many of them fentanyl or fentanyl analogs, meaning that we lost 226 Americans every day to opioids. To put this in context, 5 years ago, when Congress considered this legislation, we lost just over 53,000 Americans, or 146 a day, to opioid-related drug overdoses. This means that rates of opioid-related drug overdoses have increased by 55%. We need to approach our opioid crisis differently. The Support Act included important, well-intentioned efforts to help individuals and families in crisis. However, more needs to be done to prevent addiction, including minimizing unnecessary exposure to opioids. 90% of the acute pain patients receive opioids to manage their pain, whether they need them or not. Between 2011 and 2019, opioid prescriptions decreased by 40%, which is a good thing, from approximately 250 million to 150 million prescriptions dispensed. This is true across most payer audiences, Medicaid, private, and cash payments. However, among Medicare patients, opioid prescribing actually increased nominally. Furthermore, Medicare's share of opioid prescribing during this time increased substantially from approximately 20% of the country's opioid prescriptions in 2011 to 35% in 2019. This represents a 75% increase in just under a decade. We clearly have some work to do in Medicare to make sure that patients have access to effective pain relief agents while also not unnecessarily exposing them to narcotic painkillers. One opportunity to do this would be to enhance access to and use of non-opioid pain relief agents, and also other things that look at pre-surgical treatment, whether or not someone should be nothing by mouth for an entire time, adequate hydration, and I've seen that through places within my district. Mr. Bloom, can you detail CMS's support for policies to increase access to and availability of non-addictive pain management options? How can my office work with you to make sure that patients have robust access to these approaches?
Thank you for the question, Congresswoman. We too support the goal to ensure that Medicare beneficiaries have the full spectrum of treatment. The Part D Medicare program today monitors use very carefully to ensure that we don't have inappropriate use. That program today works very well. We're happy to follow up to learn more how CMS programs can do better.
Thank you, and I'll also keep you apprised of what's happening within my district and the unique approaches they're taking as well. Deputy Administrator Blum, H.R. 824, the Telehealth Benefit Expansion Act, would increase the ability of employers to offer telehealth-only coverage by accepting it from various laws that apply specifically to health insurance. During the pandemic, employers did this to increase access to care for employees that did not have access to major medical insurance, like seasonal and part-time workers. I have a technical question on the bill. Employer health plans are regulated through several different statutes, some of which have different requirements that are applied and enforced differently. For example, the Public Health Service Act includes requirements onto fully insured employer plans, small employer plans, and individuals that purchase major medical insurance directly from the exchanges. The ERISA statute includes requirements onto self and fully insured plans, some of which are different than the Public Health Service Act's requirement. If the bill were only to amend the ERISA statute, would fully insured employers and small employers who purchase through the exchanges be able to offer telehealth-only plans as an accepted benefit?
I don't believe so, but happy to follow up to better understand your question.
We'd certainly appreciate the follow-up, and you can do that written to the subcommittee. Thank you, Mr. Chair. I yield back.